Good morning, everyone. And actually, because we're talking to 2,000 people across the globe, good afternoon and good evening. Welcome to the very first conference of the Race and Health Observatory. My name is Gabriel, and I actually have the privilege of being chair of the advisory board for the observatory. The observatory itself is an independent expert health body established by the NHS to examine the health inequalities experienced in Black, Asian and minority ethnic communities. While it's created and working with the NHS, we are independent. And we work as a proactive investigator by mobilising new and existing research and community insights to provide evidence-based health policy recommendations for action, supporting leaders to implement and facilitating long-term transformational change across both health and care. We are data-driven and evidence-driven, as well as solution-focused. You'll hear more about our work later on this morning for Habib, our director. But I just want to take this time to say thank you to the team for all the work they have done. Their work has ensured that we are known nationally and internationally. And only yesterday I was asked by the Mayor of London, Sadiq Khan, to be his champion for tackling structural racism because of my chairing role at the Race and Health Observatory. We've only been established and working for about 18 months. As we established, we wanted to make sure that we learned, shared and progressed with others internationally. This was an original aim of ours because we've always known that ethnic health inequalities are not unique to the UK, but they are evidenced around the world. And with our international colleagues developing solutions that we could adjust and adopt, we wanted to know more about what they were doing and how they could help us in our journey and how we could help them. And you're going to hear so much from those international colleagues over the next 2 days. We started our learning journey by establishing an international group of experts, an international advisory group, to actually help us pool our resources, to share our learning and to work together on new solutions. 2 of those members were actually the co-chairs I will be introducing you to in a minute. We're continuing this journey with this conference. This is a really important sort of milestone in our journey of international solutions. We think this is going to be the first of its kind in the UK and actually globally. And I just wanted to thank the BMJ, British Medical Journey, and the Commonwealth Fund for actually being partners with us on this event and for their support beforehand as well. Over the next 2 days, you will hear from international race and health experts who will share the effects and impacts of racism on health and healthcare, as well as practical evidence-based approaches on reducing ethnic inequalities in health. There are many differences between our nations, but we are united in that we all see health inequalities in our day-to-day work and are determined to tackle them. Now it's time to introduce our 2 conference hosts. I asked for a briefing by OGS, and actually it would have taken more than my 5 minutes to share the amazing contribution that they both have made to equity. So I won't do that. I'll just introduce them, because you will hear from them during the event. So it is with greatest pleasure that I introduce the co-chairs of the Observatory International Working Group and the host for our conference, Professor David R. Williams, Professor of Public Health at Harvard University and a member of the Race and Health Observatory Board, and Yvonne Coghill, Director of Excellence in Action and also a member of our board. Thank you.
Good morning, everybody. It's absolutely fantastic to be here with you all, and particularly the 200,000 people online, the 2,000 people online.
Yes, it's an honor to welcome you to this conference. This is going to be an amazing event, and we are thrilled that you joined us today.
And just to say to all of you, apologies for you having to just wait for us to start the conference, but the wait will be well worth it, trust me. So a couple of things to say from the very, very beginning. Many of you will know that we had, back in 2005, an incident outside BMA House in London. There was a terrorist attack, and unfortunately some people lost their lives. At 9:48 this morning, 7/7, we're going to have 1 minute silence. There will be an alert for all of us, but we're going to remember the doctors and the nurses who actually helped members of the public at that time in our country when it was really, really very, very difficult. So we're going to do that this morning. There's lots to talk about now to all of you before we actually kick off with the conference, and I've got several things that I'm going to have to say. So I'm looking down at my notes to make sure that I make sure that everything's okay. This conference is what we call a hybrid conference. So we have probably about, 100 people in the room, something like that. But we have many, many more online. We want it to be interactive. We want people to be able to send their messages, write their thoughts, their concerns, their questions. So we really want you to use the facility. The platform is really, really user-friendly. So